Greg, thanks for joining us. Great to see you. And let's just go ahead and start with your introduction to the audience and give a little bit about your background, please.
Sure. Hi, good afternoon, Riley. Great to be here. I'm currently actually Director of Corporate Compliance at Emblem Health. My previous position was at NYU Langone Medical Center. So I'm primarily responsible for corporate governance, compliance policies, compliance training, conflict of interest, those types of things. But my passion project here is as the founder and leader of our LGBTQ employee resource group. And we've really been able to partner with our companies, with our communities, to try to make an impact in the digital health and actually the whole space of wellness and health for LGBTQ clients and patients within the metro area of New York City, but also within the greater Hartford area of Connecticut. And then certainly we've got some medical offices affiliated with us out on Long Island.
That's amazing. And certainly I'm definitely aware that you're having a lot of a success, but what are some of the key challenges that are faced by individuals in that community in accessing healthcare, and how can they be addressed through inclusive policies and practices?
Good question, Riley. Well, I don't think that I don't need to belabor this point, but I do need to start out by saying that the current climate, particularly in the US and in other parts of the world, there's lots of anti-gay discrimination. Not just within healthcare, but in all parts of society. So that's sort of this context that we find ourselves living in. In fact, one of the leading national organization for LGBTQ folks, the Human Rights Campaign, HRC, early this year issued a state of emergency for LGBTQ patients and people. So that's sort of the environment. Specifically, we're finding that overall, 35% of LGBTQ folks have postponed or avoided healthcare for any number of reasons due to finances, discrimination, perceived or anticipated discrimination. 40% have actually experienced discrimination from their providers. 43% have experienced general depression. 50 to 75% more than the general population are using emergency department care for general health. And we also find that there are higher percentages among this population for smoking, substance abuse disorder, as opposed to the general population. So that's sort of a grim sort of look, but there are all kinds of ways that we're finding providers, just simple things such as ensuring that you address patients by their pronouns, by their preferred name. The title of my talk mentioned SOGI, which is sexual orientation, gender identity. By capturing that type of information for transgender patients, they can go to their own patient portal. They can list their preferred name, their legal name. If they're in any stages of gender affirmation surgery, they can put that information in there as well. It's all about having a great relationship of trust and openness among LGBTQ patients and their providers.
Yeah, thank you for sharing some of those statistics around, just some of the consequences of not addressing these inclusive policies. So can you kind of further elaborate on if you don't include SOGI in healthcare, how does that impact the patient's well-being and further, create healthcare disparities? You mentioned that you want to create that environment of trust. So what's the importance if they aren't addressed? What are some further consequences?
Well, I think, it's generally the consequences would be what happens when people don't take care of themselves. Wellness, certainly suicide ideation. For instance, many transgender patients, F2M, they still may need a regular mammogram. And if they're not getting that, there's all kinds of complications and issues. If providers aren't really having a non-judgmental discussion with gay men, for instance, about their sexual health, well, they may be missing out on being able to ensure prevention and proper care regarding, for instance, we just recently had the Mpox pandemic and HIV. So those are the types of things that don't get addressed. And erosion of trust, patients will, if they've had one bad experience, they're not going to show back up to their provider. And who knows what kind of serious health consequences will come as a result of them not seeking care.
And how can healthcare providers better integrate some of these practices? Certainly, we see the consequences of not addressing patients by their preferred pronouns, but how can a healthcare provider today work to better integrate these types of practices to create a more inclusive and respectful healthcare environment?
Good question, Wiley. I think it starts with some of the same ways that they connect with all their other patients. It's approaching them as a unique individual. It's not considering them as different than. So if you ask a non-gay patient, how are they, how's their family, you would do the same thing. Are they married? Do they have a husband? If they're a gay man, if they're lesbian, do they have a wife? Not being afraid and not putting them in a separate box. It's referring to their preferred pronouns. And I would say even at the office level, some of the things that you can do is, in the office, you've got pictures of patients and families. Make sure you include same-sex couples. Include, people at Pride celebrations, as well as any other, patient populations. As far as, make sure you show diversity in your imagery. And how you promote your services on printing material on websites. It's being part of the community. Look out to connect with community organizations that are focused on LGBTQ patients. Offer to speak with them. Offer to participate in Pride or National Coming Out Day focused events and educational opportunities.
Absolutely. And can you share? I know we're running a little behind. I'll get you out here on this. Can you share some of your successful initiatives or best practices that you've seen so far that have led to increased inclusivity in healthcare? And kind of what are some of the lessons learned from those experiences?
Well, I think, one of the things that I think is very important is to have face-to-face some type of patient education session with your clinical staff, including the receptionists and the folks that greet patients. It can be simple as LGBT 101, these are things to know about, review terms, transgender, gay, lesbian, bisexual, what's the difference between birth sex, legal sex, your given name, all those types of things. And they don't need to be exhaustive and cumbersome. Cater them, customized to your individual office locations. One of the things that we do with PRISM is we started a healthcare coalition where we quarterly invite healthcare providers, social service agencies, just to come together in a safe space to share best practices, to discuss opportunities. How can we partner? I'm happy to say that Mount Sinai Health is one of our partners, and my primary care provider has been part of that network. And so he knows all about me, my history, my husband, my sexual health, all of those. Regularly look at your policies. Make sure that for a simple thing as you don't replace his and her in your policy language with their or other gender neutral language. Invite external organizations to come in for Pride Day, National Coming Out Day. I think those are some very simple, and if you don't have an ERG or a DEI council, look to start one so that you're addressing not just the unique needs of your LGBTQ patients and customers, but all other diverse segments and populations of your customer base and patient base.